A patient's poor nutritional status is the greatest predictor of an adverse outcome after surgery. We often monitor this as a patient's albumin level. Albumin is a protein made by the liver, and it goes down when a patient has poor nutritional status. Albumin should usually be greater than 4. When it's less than 3.5 or even less than 3, we see an increase in the risk of complications. In your SCOAP report, you'll find out how often at your hospital patients are having operations when their albumin is less than 4. And we break it down at levels of 3.5 and levels of 3, just so you can see the severity of the problem. Several SCOAP hospitals have found a way to avoid operating on patients with low albumin. They do this by creating a pre-surgical check of the albumin level. Sometimes they even intervene on patients with low albumin with a nutritional consultation and nutritional supplementation. The key is building in a delay between the observation of low albumin and the operation. And when talking to surgeons, they may be reluctant to build in a delay for patients, but it's going to be very important for patients that they understand their risk is increased when they have poor nutritional status. Most patients will opt for a delay in their operation if there's anything that can be done to decrease their risk of a complication. Administrators can be a willing partner in building in that kind of delay prior to operation and recognize that 55 other hospitals across the state of Washington are working to avoid all elective surgical procedures in patients with low albumin. Now, low albumin is something that may occur in patients who have emergency operations, and in that case, it cannot be avoided. And in fact, in some patients, those with cancer, those with severe inflammatory bowel disease, it may be impossible to raise the level of nutrition. But SCOAP is trying to raise the conversation and improve the chances for some patients who have low albumin to have a better outcome.